Organizations have roadmaps to their futures. Cone Health has a new strategic plan. It's one of the stories we are looking at in this month's Code View. Leading organizations know what they stand for and where they want to go. Cone Health has been guided by its strategic plan since 2010. Now we have a new one to better guide Cone Health through the changes sweeping healthcare. The patient remains at the center of everything we do, but there are tweaks. Instead of a mission, we have a purpose. Together we create unsurpassed healthcare experiences.
We're anticipating what that future is going to look like. It's going to call us to do things differently, to do things in new and innovative ways, to do nothing less than transform what we're trying to accomplish.
Instead of vision, there is intent. We are the leader in delivering integrated, innovative healthcare.
It talks about leadership, it talks about integration. That brings all the various aspects of healthcare together, brings all the various stakeholders together, physicians, other care providers, other folks on the team. And it also speaks to innovation. How do we do things in new and different ways in order to accomplish our purpose?
If you'd like more information on the new strategic plan and how it applies to you, go to ConeConnects/strategic plan. Several times a year, you turn to a computer-based learning system to update a skill, renew a competence, or to pick up something entirely new. That should become a much better experience thanks to a computer-based learning system called HealthStream Learning Center. It has replaced the previous online system and promises to be more intuitive and easier to use for test takers and test makers.
There's a lot of free content in the program in terms of continuing education and programs that they've already developed that meet our Joint Commission requirements, our mandatory requirements, that we don't have to pay for. It's a part of the contract.
When staff education searched for a new computer-based learning system, it didn't have to look far. HealthStream is used at Alamance Regional Medical Center. A new entrance opens later this month at Cone Health Behavioral Health Hospital. This means patients, especially involuntary patients, won't have to walk or be escorted through a crowded visitor lobby.
A lot of times they have shackles, their feet are in shackles, or even their hands can be in shackles. And for them to have the same interest as our general public, be it visitors, be it anyone, someone else coming from Cone system, they all were using the same entrance. So now giving them another entrance, it gives them that dignity to be able to come into a place without being looked at in a negative manner.
An observation unit also opens in December. This space will provide treatment to 7 people who can be moved from emergency departments. These patients won't have traditional medical problems and can be stabilized in under a day. Scrooge lives, and he walks through parking lots this time of year looking for something of value he can quickly steal.
This is something that we routinely see this time of the year. We see a lot of, around the holiday season, we see thieves out in their mode of trying to steal from valuables from others.
Causey reminds you not to keep valuables in your car. If you have to, lock them in the trunk before you drive to your destination. Hundreds of area women who can't afford a screening mammogram will get one thanks to the Women's Only 5K Walk and Run. The 22nd event raised more than $110,000 for the Mammography Scholarship Fund. Last year, nearly 700 women received mammograms through the fund. Mammography remains the best way to fight breast cancer early. That's it for this edition of Code View. I'm Doug Allred. Happy holidays.